Hi, my name is Kalia McShann, and I want to thank you guys for continuing this journey with me as far as my dissertation topics and my doctoral journey. From an operational perspective, I would love to hear some topics as far as healthcare operations. One, maybe two, that I have considered was for providers how to improve the emergency medical records to basically help streamline like labs, um, more like a better communication system so that physicians are not double ordering tests, causing insurance to reject payments and causing patients to constantly um, receive like double testing because one system isn't communicating with the other. We know that we have Epic system, we know that we have care everywhere, but how can we streamline a process that if a patient is going for like hepatology, if they're going to their primary care, all of the tests that's ordered, everything that is seen in real time, and something that will alert a physician if you even try to order, that will, like, even if it's a medication or whatever, you know how pharmacy will have a contraindication to something or alert saying, hey, this you can't give this medication, something that would trigger the system so that a doctor isn't ordering the same test, so that patients aren't getting charged for basically duplicate testing and unnecessary procedures because the system isn't communicating with each other. So I am curious to see what all of those informatics and tech savvy professionals, what do you have to say regarding this? And if there is something that exists now that we may or may not know that healthcare organizations and clinics can use to help mitigate this issue of double treating, and insurance is not covering because patient had a CBC last week and now they don't have the results and we need a stat CBC. What can come up in the system that will prevent a provider of actually ordering that test unnecessarily, and so that everybody can be on the same page? So that's one topic. The other topic I was basically considering is, for as far as operation, is waste. In healthcare, we see so much waste going on, especially if you work in surgical procedures or even in clinics itself, just wastefulness. What are some areas in your healthcare industry that you see waste going all the time? What can we do to help be good stewards over our budget and not be so wasteful? All the just basically everything adds up, and when you're looking at the bottom line of your fiscal budgets, what can we do to help mitigate a lot of issues regarding waste? So give me some suggestions. I have a few in my mind, but also I've talked with several people regarding this and what they're doing in their healthcare organization, even with sustainability of, it could be basic lighting, so that we're not wasting energy and different things like that. So please leave a comment or any suggestions that you think will be helpful for a dissertation topic regarding healthcare operations. What can we improve on? And even if you're a patient, so I'm looking for all stakeholders. I just don't want to exclude this journey to healthcare professionals, but if you are a patient, not just a patient, a person, an individual that have experienced a positive or negative effect in the healthcare, what are some suggestions or experiences that you can share with us so that we can better prepare and equip one another to take care of each other? So leave a comment, like and subscribe, and I look forward to continuing this journey with you. Super excited. I hope you are too.